Hi, I'm David Shearman, host of Politically Speaking on Rogers TV. Politically Speaking is your chance to hear all of our politicians, local, provincial, federal. Answer your questions, listen to their ideas. Politically Speaking on Rogers TV.
Sometimes, for a wish to come true, it takes a kingdom, because together is stronger. Tied tight, united we stand, in honor of one child's wish, to fuel the fire that will grant many more. Join the kingdom.
This is Rogers TV, Grey County.
Hello and welcome to this special edition Rogers TV program dedicated to COVID-19 and informing you of services and programs available to you in our community. My name is Carol Merton, and before I welcome our guest to the program, I want to just say a few words of thank you. For those of you who watch the program, you know I like to do that at the very beginning. And today I'm absolutely delighted to mention that Rogers Sports and Media is actually launching an initiative to say thank you to all of our frontline workers. And today is International Nurses Day. It's a Hearts and Smiles campaign. And what Rogers is doing is inviting you and family, all the community, to consider purchasing t-shirts and mask combos or 10 packs of masks by going on to www.heartsandsmiles.ca. The money from the proceeds of these sales actually goes to what they call a frontline fund. This is created by hospital foundations themselves, and it's a charity that is supporting more than 150 hospital foundations across Canada which are battling COVID-19. What this foundation and this fund does is it provides supplies for healthcare workers, personal protective equipment, support for healthcare workers if they need hotel rooms near hospitals or mental health resources and supports. And it goes towards research, clinical drug trials, vaccine development, and a variety of things. In addition, up to 10% of all the funds that are raised will be allocated to the Canadian territories and certainly to the Aboriginal communities. So Rogers TV is indicating that our frontline warriors continue to have our backs through COVID-19, and it's time for us to have theirs as well. So we invite you to participate in this initiative. And on that note, I want to welcome our speaker today, Dr. Kathleen Finlay, who is a naturopathic doctor, who's here to talk to us about naturopathic care, how her practice is functioning through COVID-19, and maybe provide us with some helpful hints and strategies on how to stay healthy throughout this pandemic. Welcome and thank you for joining us today.
Thank you, Carol. I appreciate being on here today. Thank you very much.
My pleasure. I don't think we've chatted on the phone before, but I don't think I've had the pleasure to actually interview you before. I think this is first, so I'm delighted that you're able to be here. Can you tell me a little bit about yourself, how long you've been in the community and how long you've been practicing naturopathic care?
I've been practicing for almost 22 years now in this area. I first started out over in Craigleith area, Collingwood, Craigleith, but I was commuting, and then I just centered myself in Owen Sound. Yes.
So for those who may not be as familiar with the concept of naturopathic care, I know we have 30 minutes. You could probably fill in an encyclopedia with what naturopathic care is, but I'm wondering if you could just mention to our viewing audience what it is and how it works alongside other aspects of healthcare.
Yes. basically it's using natural means to help the body heal. It's working with the physiological system to support people's basic physiology. It involves sometimes nutritional supplementation, well, often always nutritional supplementation in terms of dietary modifications, food intolerance, food allergies. We consider things that might be impeding their natural healthy function. So we're always looking to see what obstacles may be affecting their health or imbalances that are occurring. And stress is always a number one factor that we consider, and help people with different strategies to deal with their stress. And we use herbal medicine as well for different conditions, nutraceuticals, vitamins, minerals. Acupuncture is very helpful for certain, well, many conditions, but certainly pain is one thing that it works very well for. Mm-hmm.
So it takes a lot of time to actually go through training to become a naturopathic doctor. In this day and age, how long would someone need to go to be trained? I know it's always changing, but
the minimum would be, I believe, 7 years.
And that's university training?
University first, and then 4 years naturopathic. So minimum 3 years university, and then another 4 years naturopathic, yes.
So it's quite a long and intensive process to get to the point where you are at this point in time, for sure. So tell me how pre-COVID you would consult with I'm not sure if you call them patients or if you...
Yes, we call our clients patients.
Yeah. So pre-COVID, what would someone expect if they were to come and meet with you? And then how has COVID-19 changed the way that you're able to provide your service?
Yes. Pre-COVID, people phone or book appointment online. I have online booking system now in place. And patients would come to my office, and we take their whole total health history, family history, and examine supplements they've been on, examine any laboratory blood work, diagnostic imaging, look at it, the whole picture, the whole person. And then between the patient and I, we talk about different treatment options and treatment plans, and then follow-up appointments are scheduled after that, usually 4 to 6 weeks after the initial appointment. Initial appointment is about an hour and a half to 2 hours long to get a good feel on that. We do, physical exam where necessary, definitely blood pressure, pulse, and all of that, and just examination of the person. But after COVID, I had a protocol in place that I was going to implement in terms of just keeping the office sterile or disinfected between visits and spacing out patients better. But then I decided that my online provider, or my electronic medical record provider, had already a system in place to do video, HIPAA, I don't know, HIPAA compliant, secure systems that we can do video, non-recorded video consultations. And so I've been doing that, or phone. I'm definitely wanting to do video for new patients, but there's a few that still in this area are having technical difficulties and can't quite do the video. So we're doing phone.
Yeah.
For various reasons. Some people don't feel comfortable with a video consult, and some people just don't have the technology, or they're having computer problems. So and
so you have to be adaptable based on how people can communicate.
And they can show me things, but I can't take their blood pressure or their pulse and do certain things. But I can do quite a lot via this mode, and I'm set up to do it. So I'm happy that I'm still able to continue to help people.
Yeah. So the age frame of your patients, would you say you do from youth all the way?
Yes, all the way. The cluster, I would say, would be age 40 to 65. That would be the majority of my patients in that bracket. But I do see patients of all ages, for sure. Mm-hmm.
So you've certainly had to modify in how you provide the care. How has that felt to you as the clinician, and what are your patients saying back to you about how they feel on the receiving end?
It's been very positive. Some people are quite happy that they can just do it from the comfort of their home. And so I've had a few people that have said, I'll see you when we're back live and you can come in person. I've had a few people definitely say that. But I feel okay about it. It's been okay. But I definitely would prefer to see the patients in my office. Mm-hmm.
It's sometimes hard to get that kind of interaction and relationship back and forth across a screen, for sure.
Yes.
Yeah. So everyone is having to pivot in how they provide care. So from your perspective, we're in a different situation. You mentioned stress earlier. What are you noticing around what you're hearing from patients or what you're observing just generally when you're out and about?
I'm seeing actually a little bit less stress for my patients that are not working, which is very interesting. And a lot of people are feeling they have time to reflect. So they feel, I'm actually seeing patients getting better.
Wow.
Yes, which is very interesting. It's all, doesn't it? So, but it's giving them time to rethink things. And the trick, and we're trying to talk about this, is, okay, this is great, but how can you bring some of that feeling back when you do go back to your jobs? Most people will be going back to the same work. Some people may have a complete change, but if for those that are going back to the same work that was causing stress, how can they modify it? Or maybe this is the time they can learn some skills, such as, breathing, meditation, hydration has been a huge one that people are actually having more time to drink water, and that's made big differences for people.
Yes.
Mm-hmm.
So the absence of stress, even though COVID-19 is a different type, but the absence of the everyday work-related stress and living stress, you're seeing a change in people, and it's not a bad change.
No, I think for the people that I see anyway, I understand that it isn't like this for a lot of people, but for those people that are just the people that I have talked to have been feeling very good in general, and I think they've welcomed the break. The majority, I think, have enjoyed the break if they have gotten a break from work. So, but I think I haven't seen a lot of people on the front line, so that would probably be a different situation, a different story.
Yes. Absolutely. Yeah, for sure. Yeah.
It's giving that extra time to take care of yourself. I think that's making a difference with these people, getting more exercise, eating a very good diet or a better diet, hydration, self-reflection.
Yeah. Are you hearing about sleeping patterns? What are people mentioning to you about sleeping patterns?
I haven't heard a lot, other than people are with less stress, they are sleeping better.
Yeah, so that helps for sure in staying healthy. So COVID-19 is a virus that we don't have an immunity for. Mm-hmm. From the naturopathic perspective, are there things that, and I realize you're not prescribing, we're talking about general health, because it has to be on a one-to-one consult. But generally, do you have advice to people around how to maintain or how to be as healthy and strong in their own systems as possible? Do you have anything you'd be comfortable sharing?
Yes, I mean, they don't have any direct studies on COVID-19 per se, because it is new, like you said. But they do know that a strong immune system and is very important to fight this or handle it safely, more safely.
Yeah.
So there's still a lot we're learning about it. I'm listening to. I have Sirius radio, so I can listen to. In New York City, they have a bunch of doctors that are talking constantly about COVID-19 and all the different aspects and different discoveries as they're coming through. And I've done some webinars with. There's a cardiologist in Arizona, Scottsdale, Arizona, and he's also a naturopathic doctor. So he practices functional medicine is basically what they're calling it. And he's educating his patients about resilience. And he's gone through some of the research, and I've been listening to that. And I've got some good references in terms of very well referenced antiviral books that document the herbs. And the studies have been done mainly on the previous SARS. So for the herbal medicine. But the herbs are more, they're used, what they're finding, which is very interesting, is that a lot of the adrenal herbs, which are, adrenal gland is your stress gland. And in naturopathic medicine, we do a lot with the adrenal glands for stress. And they found that a lot of those herbs, such as rhodiola, holy basil, Siberian ginseng, are also antiviral, which is very and a lot are anti-inflammatory as well. So they go hand in hand with the herbs that actually just fight viruses, such as lomatium is a particular herb. Golden seal can be very good, or berberine herbs. So there are a lot of definitely really good medicines out there for people, but it would be something that you wouldn't necessarily do on your own, because there are contraindications if you're on certain medications and things like that. And it depends on the symptoms. Herbs generally, herbal prescribing is very based on symptoms picture. And often you're using combinations of herbs, not just one single herb. For example, licorice root is a very good herb. It's antiviral. It's very good for the adrenal glands. However, it doesn't go really well with high blood pressure medications, diuretics. You can lose your potassium with it. If it was just taken long-term by itself, it could increase your blood pressure. But generally, we use them in balance with other herbs, and it's based on the symptoms that we're seeing. Like if we're seeing, more pulmonary or lung symptoms, then we're going to use herbs that are more specific to that area of the body, because herbs can target areas of the body. And then in terms of, from what I'm hearing from the doctors who are on the front line fighting this, they're basically saying hydration is key. Your lungs need to be hydrated to fight. And no matter where you are, if you're not hydrated, doesn't matter what treatment you get, you're not going to do as well if you're not hydrated. So that's interesting that the doctors are saying this. And for exercise is very important in terms of, in general. So we know it's important for stress management, and for exercising the lungs and the heart and keeping them. But they're saying that basically, even if you do come down with COVID-19, that you have to keep those lungs moving. And even if you don't feel like walking or moving or doing anything, you have to. I'm sure you know this, Carol. And I don't know, are there specific exercises that you would recommend a patient to do if they're lying on the couch with COVID-19?
What we're both agreeing on is physical activity is critical to stay healthy and to keep your function going. And we do know that with the disease process, we're learning all the time because it's so different in how it impacts people. But certainly, as you said, lungs and heart, absolutely, for sure. From your perspective, you mentioned hydration, and I know That's probably near and dear to your heart for sure. People struggle with knowing what good hydration or how much hydration they should do. Do you mind sharing, what do you tell your patients?
It depends on the person but I would say a minimum would be a liter, and then some people can handle 3 liters a day. It depends on their kidney function.
Yeah.
If you have compromised kidney function, you might not want to be drinking 3 liters of water a day because it does have to go through the kidneys and it makes them work harder. However, the kidneys do need to be hydrated too. So it's one of those things that you have to be in. You can't go. You have to be in the middle, I would say, with that. Like 1.5 liters is probably the average that I would recommend people to drink. Yeah. And it could be tea, it could be a liquid in the form of teas too, like non-caffeinated teas, because caffeine tends to be a diuretic and make you pee out the water. So you can't be doing it on just caffeinated things.
Yeah. And you raise a good point. In other words, there's no magic number where it's got to be so many glasses per day, because people have read that. What you're really saying is there's a range, and that range works for different people, but the key is to keep trying to stay hydrated and recognize how absolutely important that it is. Mm-hmm. Have you seen anyone who has had COVID?
No, I haven't. Well, actually, I did speak with one patient who thinks they may have had it in January. So, wow. And she had her whole family, went right through everybody, and she swears it was. She didn't go to the hospital. They didn't need to. They had some, colloidal silver or something on hand. They used a few things that they felt were helpful. Yes. And colloidal silver has been around for a long time, and it's even used medically on bandaging and things like that. So there's forms that can be done topically, and then there's the oral form as well, which is sort of antimicrobial, and it can be a help. But yeah, so I haven't actually seen anybody with it, but again, but even a consult, I haven't seen someone in the midst of it.
Yes. Mm-hmm. You raised a really important point earlier about that there are certain amounts of medication to take, our herbs, natural herbs, and that you can take too much or not enough. What would you say to people who decide, I want to be strong, I'm just going to pick up some things from a convenience store of some sort?
Well, I think you have to look at quality. So I would recommend, if you're going to do anything, it should be at a health food store or a naturopathic doctor or a chiropractor if there's a chiropractor that you believe is trained in that type of thing. But the dosages on the bottle in general, I would say for everything across the board, are on the low side. For Health Canada has a very low threshold of what they'll allow people to write on the bottle. So the dosages on the bottles are very low and probably not that helpful. It's probably best to consult with somebody about it. Even some pharmacists know a little bit about things, like natural things. And then, of course, if you're on medications, you definitely have to put it through your pharmacist to make sure there's no interactions with, especially herbs, but some nutrients as well, such as potassium is a big one if you're taking potassium. But generally vitamins and the big ones for the immune system are zinc, vitamin D, vitamin A, selenium, fish oil. Fish oil is very good for the cells. And zinc stimulates the white blood cells. They all have their role. And so, a good multivitamin isn't going to hurt to have someone just make sure they have their nutrients in place. But the quality is important. You're not going to necessarily get good quality from a drugstore. I hate to say it, but they have a few things that are okay, but you're going to get a better quality usually from one of the health food stores in town, or there are some sources online as well that are good. But there are different qualities of vitamins, and some vitamins are made from, byproducts from industry. And so it's basically you're eating garbage, and it's not that bioavailable sometimes. So yeah, definitely quality I feel is important to get your money's worth.
Right. Do you in your practice actually dispense these products?
I tend to dispense things that are not readily available in stores or in public, but I feel they're important. So, but generally, I dispense some things like that if they're not available anywhere else, or I'll recommend go to the health food store, or there are some good online sites as well. Yeah. Right now online is helpful, but they are doing curbside pickup at the health food stores in town. I've connected with them, and they're still working and servicing their clients, and I still send people to these stores to get some basic things.
So certainly supporting the businesses that are out there, although the way that they're providing the goods is definitely different. So those people who want, are able to do this. I'm wondering in the future, as hopefully we get through this COVID-19, and I'm not sure what it'll look like on the other side, do you anticipate you'll do your practice differently?
I still would. I will probably have more phone consults and more video consulting than I did before, because now I think it's opened people up to it a little bit more, and they're realizing it's, especially in the winter around here. I've got a lot of people up on the peninsula, and that's a big trip in the winter time to come down to Owen Sound. I mean, they usually have other things to do, so it's out, but it will be helpful for people just to know that this works too. You know, you can still get good information and help doing it this way. So it will change it a little bit, but it'll definitely change in my protocols to make sure it's clean for I mean, it's always been clean. We have standards we have to follow anyway, but everybody's having to step it up. So.
Yes. Yeah, it's opening up a whole different practice pattern for a lot of professionals, actually. Absolutely. So we've got about a minute and a half in the program, and I wondered if there's something I haven't asked you that you'd like to share.
I'm just looking. I wrote a few notes down. I'm just seeing if I can find anything that I would like to say.
How are you taking care of yourself? Maybe I'll ask you that question.
Getting more sleep. I think that helps. So, how about you?
Yeah.
I do think people are getting more sleep, and that's helping too with their health. Sleep is very important. I didn't mention that one. But we've been pretty lucky around here because we haven't been hard. I don't feel that we've been hard hit compared to a lot of other places. I do think we have to be prepared, because I do think the way that it sounds like from a lot of doctors I've been in touch with is that we're all going to get it. And at some point, whether we're going to get symptoms or not, we don't know. So keep yourself healthy, and don't go back to old patterns when you go back to, some of the same.
Good point. Yeah, good point. And on that note, our time is up. I want to thank you very much for appearing on the program. It's been delightful. And thank you to our viewing audience for joining us today. Please join us again to learn more about programs and services available to you. Take care. Stay well.
Thank you, Carol.